Health and illness. Asking about health. Health is the state of the body. When doctors want to know about a patient's usual health, they ask questions such as: what is your general health like? How's your health generally? If you are in good health, you are well and have no illness. If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong, not ill. Healthy, fit, in good health, well, very well, fit and well. Ill, unhealthy, unfit, unwell, in poor health, poorly, not well, not very well. Sickness. Sickness has a similar meaning to illness. It is also used in the names of a few specific diseases, for example, sleeping sickness and travel sickness. Patients also talk about sickness when they mean nausea and vomiting. Patient says, I was sick this morning. Possible meanings: I was ill this morning, I feel unwell this morning, I vomited this morning. Patient says, I feel sick. Possible meanings: I feel ill, I feel unwell, I am nauseous, I feel the need to vomit. The combinations sickness and diarrhea means vomiting and diarrhea. Recovery. When patients return to normal health after illness, they have recovered. We can also say the patient made a good recovery, the patient made a full recovery, the patient made a complete recovery. If a patient's health is in the process of returning to normal, the patient is improving. The opposite is deteriorating. We can also say that the patient's condition improved or deteriorated. In speech, we often use the verb get to talk about change. Get over, to recover, get better, to improve, get worse, to deteriorate. If a patient is better but then gets worse again, the patient has relapse, another word for improvement, especially in recurrent conditions such as cancer, is remission. Get over the illness very quickly. 2 years later, the remains is complete remission. En español, la salud y enfermedad. Preguntando sobre la salud. La salud es el estado del cuerpo. Cuando los médicos quieren saber sobre la salud habitual de un paciente, hacen preguntas como: ¿cómo es tu salud en general? ¿Cómo está tu salud generalmente? Si estás en buena salud, te encuentras bien y no tienes ninguna enfermedad. Si estás sano, normalmente te sientes bien y puedes resistir enfermedades. Si estás en forma, eres fuerte y saludable. Diafragma. Saludable puede significarse en forma, bien y no enfermo. No saludable puede ser en mala forma, indispuesto y enfermo. Enfermedad. El término sickness tiene un significado similar a illness. Ambos significan enfermedades. También se usan los nombres de algunas enfermedades específicas, como el sleeping sickness, que es la enfermedad del sueño, y el travel sickness, que es el mareo o movimiento. Los pacientes también pueden usar sickness cuando se refieren a náuseas y vómito. Por ejemplo, aquí, donde el paciente puede decir I was sick this morning, estaba enfermo esta mañana, alguno de sus posibles significados puede ser: estaba enfermo esta mañana, no me sentía bien esta mañana, estuve vomitando esta mañana. Si dice me siento enfermo, puede significar me siento enfermo, no me siento bien, tengo náuseas y siento la necesidad de vomitar. La combinación de enfermedades y diarrea. significan eso, enfermedades y diarrea. Sickness and diarrhea. Recuperación. Cuando los pacientes vuelven a su salud normal después de una enfermedad, han recuperado su salud. También podemos decir que el paciente tuvo una recuperación buena o completa. Si la salud de un paciente está en proceso de volver a la normalidad, el paciente está mejorando. Lo opuesto a esto es deteriorarse. También podemos decir que la condición del paciente mejoró o empeoró. En el habla cotidiana usamos el verbo get para hablar de cambios. Por ejemplo, la expresión get over puede significarse recuperarse, get better, mejorar, y get worse, empeorar. Si un paciente mejora pero luego vuelve a empeorar, el paciente ha recaído. Otro término para mejoría, especialmente en enfermedades recurrentes como el cáncer, es remisión. Por ejemplo, se recuperó de la enfermedad muy rápido, 2 años después ella sigue en completa remisión. Complete the table with words from A and B opposite. The first one has been done for you. Noun: fitness, health, illness, sickness. Adjective: fit, healthy, ill, sickness. Make word combinations using a word from each box. Look at B and C opposite to help you. Complete, feel, get, poor, travel. Sickness, health, remission, sick, over. Combinations, word combinations. Complete remission, feel sick, get over, poor health, travel, sickness. Complete the conversation. Look at B opposite to help you. Doctors: how are you feeling today? Patient: not very well. Doctor: how long have you been feeling sick? Patient: about a week. Doctor: what is your health like normally? Patient: very good. I'm usually quite fit and healthy. Doctor: what is the problem now? Patient: it's my stomach. Doctor: do you feel sick? Patient: yes. Doctor: have you actually been vomiting? Patient: no. Doctor: have you had any serious illness in the past? Patient: no, not at all. Choose the correct word to complete a sentence. Look at B and C opposite to help you. Her condition deteriorated and she died. He recovered and was allowed to go home from hospital. The cause of sleeping sickness was discovered in 1901. The patient made a full recovery. I have been good health for a month and feel very fit. I was a month before I got over the illness. They seems to be rather unhealthy. His diet is bad and he never exercised. Parts of the body. Most external parts of the body have ordinary English names, as well as anatomical names. Doctors normally use the English names, even when talking to each other. There are a few exceptions where doctors use the anatomical name. These are shown in back below. Jaw, neck, shoulder, armpit, upper arm, elbow, back, buttock, wrist, thigh, calf, leg, chest, breast, stomach, tummy, navel, hip, groin, knee, chin. Limb means arm, upper limb, or leg, lower limb. The trunk is the body excluding the head and limbs. For a more detailed diagram showing parts of the body, see Appendix 1 on page 130. referring to part of the body. When patients speak about their problems, they often refer to a part of the body. I'm having trouble with my hip, I'm having trouble with my shoulder, I'm having trouble with my knee. The doctors often need to ask about a part of the body. Do you get any pain in the chest? Do you get any pain in the stomach? Do you get any pain in the back? Describe with radiation of pain. Radiation of pain. A patient is telling the doctor about the back pain and the part of the body is radiates to. It starts in the back. Then it seems to go into the right button and down the back of the right thigh to the knee. Partes del cuerpo. La mayoría de las partes externas del cuerpo tienen nombres comunes en inglés, así como nombres anatómicos. Los médicos normalmente usan los nombres en inglés incluso cuando hablan entre ellos. Hay algunas excepciones en las que los médicos usan el nombre anatómico, que son los que se muestran entre paréntesis del listado. El número 1 significa mandíbula, número 2 cuello, número 3 hombro, número 4 axila, número 5 brazo superior, el 6 es codo, el 7 espalda, el 8 nalga, 9 muñeca, 10 muslo, 11 pantorrilla, 12 pierna, 13 pecho o tórax, el 14 seno, el 15 estómago, barriga, abdomen, el 16 ombligo, la 17 cadera, la 18 es la ingle, la 19 rodilla. Miembro significa brazo, que puede ser el miembro superior o la parte de la pierna, que es el miembro inferior. El tronco es el cuerpo, excluyendo la cabeza y las extremidades. Para un diagrama más detallado que muestre las partes del cuerpo, se consulta en el apéndice de la página 130. Refiriéndose a las partes del cuerpo. Cuando los pacientes hablan sobre su problema, a menudo se refieren a una parte del cuerpo, como por ejemplo, tengo problema en mi cadera. El médico a menudo necesita preguntar sobre una parte del cuerpo también. ¿Sientes algún dolor en el pecho? Por ejemplo. Apartado C. Describiendo la irradiación del dolor. Un paciente le está diciendo al médico sobre su dolor de espalda y las partes del cuerpo a las que se irradia. Comienza en la espalda, luego parece que se va hacia el glúteo derecho y baja por la parte posterior del muslo derecho hasta la rodilla. Write the ordinary English words for the corresponding anatomical terms in the table using your medical knowledge. Look at a opposite to help you. Anatomical term: abdomen. Common word: belly, stomach. Anatomical term: axilla. Common word: armpit. Anatomical term: carpus. Common word: wrist. Anatomical term: coxa. Common word: hip. Anatomical term: cubitus. Common word: elbow. Anatomical term: mama. Common word: breast. Anatomical term: nates. Common words: buttocks. Anatomical term: patella. Common words: kneecap. Complete the sentence using ordinary English word. Look at A and C opposite to help you. A male patient describing angina pectoris. It's like a tightness across my chest, and it goes up to my arm and into my left shoulder and down the left hand. A male patient describing renal colic. It starts in the loin and goes into the groin and radiates into the testicle. Complete the sentence. Look at A opposite to help you. Anatomical terms. Angina, swelling. Abdominal pain. Periumbilical rash. Thoracic pain. Enlarged axillary node. Mandibular pain. Patient estrangement. I've got a lump in the groin. My little boy's got a stomach ache. I've got some spot around my belly. I've got a pain in the middle of the chest. There is a painful swelling in my armpit. I've got a pain in my jaw. Complete the table with words from the box. The first one has been done for you. Abdomen, elbow, loin, wrist, thigh, knee, chest, arm, leg, finger. Trunk, abdomen, chest, loin. Upper limb, arm, elbow, wrist, finger. Lower limb, thigh, knee, leg. The abdomen. The main organs of the body have ordinary English names and doctors use these words. But when an adjective is needed, they often use an anatomical word. For example, we can say disease of the liver or hepatic disease. Some abdominal organs, for example the pancreas, have no ordinary names. Pancreas, duodenum, gallbladder, liver, right kidney, left kidney, spleen, stomach. When doctors talk about the main parts of the digestive system, they use the word bowel or intestine, the small intestine or the small bowel, the large intestine or the large bowel. When speaking to patients, doctors may refer to the anus and rectum as the back passage. The chest. The chest, thorax, contains the organs of respiration and the heart. The main part of the respiratory system are the airways and the lungs. The left lung is divided into 2 lobes and the right into 3. The airways consist of the larynx, the trachea or windpipe, the right and left bronchus, and the bronchioles. The chest is separate from the abdomen by diaphragm. The pelvis. A doctor is explaining the functions of the bladder to a patient. The bladder is situated in the pelvis, as you know, and it is connected to each kidney by a long tube called the ureter, one on each side. The ureters carry the urine from the kidney to the bladder, where it is stored until you decide to empty your bladder. When that happens, the urine passes down another tube called the urethra to the outside. Partes del cuerpo. El abdomen. Los principales órganos del cuerpo tienen nombres comunes en inglés y los médicos usan estas palabras. Pero cuando se necesita un adjetivo, a menudo usan una palabra anatómica. Por ejemplo, podemos decir enfermedad del hígado o enfermedad hepática. Algunos órganos abdominales, por ejemplo el páncreas, no tienen un nombre común. Aquí los nombres en español: páncreas, estómago, duodeno, vesícula biliar, hígado, brazo, riñón derecho y riñón izquierdo. Una sección transversal del abdomen vista desde abajo. Es lo que representa la imagen. Cuando los médicos hablan sobre las partes principales del sistema digestivo, usan la palabra intestino o intestino. El intestino delgado o el intestino grueso. Cuando hablan con los pacientes, los médicos pueden referirse al ano y al recto como el conducto posterior. El pecho o tórax contiene los órganos de la respiración y el corazón. Las partes principales del sistema respiratorio son las vías respiratorias y los pulmones. El pulmón izquierdo está dividido en 2 lóbulos y el derecho en 3. Las vías respiratorias consisten en la laringe, la tráquea o conducto de aire, el bronquio derecho y el bronquio izquierdo, y los bronquiolos. El pecho está separado del abdomen por el diafragma. Pelvis. Un médico le está explicando la función de la vejiga a un paciente. La vejiga está situada en la pelvis, como sabes, y está conectada a cada riñón por un tubo llamado uréter, uno a cada lado. Los uréteres transportan la orina desde los riñones hasta la vejiga, donde se almacenan hasta que decides vaciar tu vejiga. Cuando eso sucede, la orina pasa por un tubo llamado uretra hacia el exterior. Label the diaphragm using words from the box. Look at B opposite to help you. Number 1 is one pipe. Number 2 is lung. Number 3 is lobes. Number 4 is diaphragm. Number 5 is airways. Number 6, heart. Number 7, bronchioles. Match the condition with the organs affected using your medical knowledge. Hepatitis is with liver. Pneumonia is with lung. Nephritis is with kidney. Gastric ulcer is with stomach. Cystitis is with bladder. Angina pectoris is with gallbladder. Ulcerative colitis is with large bowel. Complete the textbook as extract. Look at A and C opposite to help you. Examine of the abdomen. To examine the patient for enlarged abdominal organs, first feel for the liver and the gallbladder on the right side. To do this, ask the patient to take a deep breath while pressing with the finger upwards and inwards. Next, feel for the right kidney and then cross over the other side for the left kidney. Still on the left side, palpate for an enlarged spleen. Finally, moving to the lower abdomen, feel for the bladder, which is only filled if it is full. Functions of the body. Eating. You are hungry. You are in a restaurant and the waiter brings your food. You smell it. It simulates your appetite. You want to eat. Your mouth waters, filling with saliva. You take a bite of the food. It tastes good and you chew it and swallow it. You eat more, but then suddenly you taste something unpleasant. You feel nauseous. You rush to the toilet and get there just in time before vomiting all the food you've been eating. Something has disagreed with you. The 5 senses. In addition to smell and taste, the sense includes sight or vision, hearing or touch, also called sensation or feeling. To ask about the sense, doctors use the question, what is your sight like? What is your hearing like? What is your sense of smell like? What is your sense of taste like? Is your sight normal? Is your hearing normal? Is your sense of smell normal? Is your sense of taste normal? To ask about the sense or touch, doctor talk about numbness, loss of sensations. Have you noticed any numbs in your finger or toes? Other functions. Functions speak, verb speak, nouns speech. Functions walking, verb walk, noun gait. Function breathing, respiration, verb inhale, breathe in, take a breath in, exhale, breathe out. Noun breathe. Function urination, micturition, verb urinate, micturate, pass urine, pass water. Noun urine. Function defecation, verb defecate, past faces, past stalls. Nouns faces, stalls. Functions menstruation, verb menstruate, have a period. Noun menstrual period, monthly period. When talking a history, doctors can ask, do you have any trouble walking? Do you have difficult breathing? Do you have problem passing urine? Do you have problems with your pitch? Do you have any pain when you breathe in? When auscultating a patient's lungs, the doctors tell the patient, take a deep breath in, hold your breath, then breathe out completely. Less common function. There are some things we do less often. When we are hot, we sweat. When we are not nervous, we shake. When we are sad, we cry. Doctors can ask, do you sweat more than usual? Do you shake more than usual? Funciones del cuerpo. A comer. Tienes hambre. Estás en un restaurante y el camarero trae tu comida. La hueles, estimula tu apetito y quieres comer. Se te hace agua la boca, se llena de saliva. Tomas un bocado de la comida, sabe bien y la masticas y la tragas. Comes más, pero de repente sientes algo desagradable. Sientes náuseas y corres al baño. Y llegas justo a tiempo antes de vomitar toda la comida que has comido. Algo te ha sentado mal. Los 5 sentidos. Además del olfato y el gusto, los sentidos incluyen la vista o visión, el oído y el tacto, también llamado sensación o sentimiento. Para preguntar sobre los sentidos, los médicos usan las preguntas: ¿cómo es tu vista? ¿Es normal tu sentido del olfato y tu sentido del gusto? Al tomar la historia clínica, los médicos pueden preguntar: ¿tienes algún problema para caminar, para respirar? ¿Tienes algún problema para orinar, para hablar? ¿Tienes dolor cuando respiras? Al auscultar los pulmones de un paciente, el médico le dice al paciente: respira hondo, aguanta la respiración y luego exhala por completo. Funciones menos comunes. Aquí el cuadro prácticamente tiene todo el mismo significado. Funciones menos comunes. Hay algunas cosas que hacemos con menos frecuencia. Cuando tenemos calor, sudamos. Cuando estamos nerviosos, temblamos. Cuando estamos tristes, lloramos. Los médicos pueden preguntar: ¿sudas más de lo normal? ¿Tiemblas? ¿Sudas más de lo normal o tiemblas más de lo normal? Match the symptoms to the questions using your medical knowledge. Dysuria is with B. Do you have any pain when you pass water? Dysphagia is with D. Do you have any trouble slowing? Diplopia is with E. Is your vision normal? Dysphagia is with C. Do you have any difficulty with your speech? Dyspnea is with A. What is your breathing like? Patients are describing symptoms of the conditions showing brackets. Complete the sentence. Look at C and D opposite to help you. I've got a pain and numbness in both feet. I'm having difficulty swallowing solid food. I have a lot of problems passing water. I've been sweating more than usual, even when it's not hot. I've noticed that my hands shake when I'm not using them. I have trouble breathing when I climb the stairs. Complete the sentence. Look at A, B, C, and D opposite to help you. When I eat solid food, I have to chew it for a long time before I can swallow it. Do you have any pain when you pass stools? I have no appetite, and I've lost 5 kilos in the last few weeks. When did you last have a period? The garden is full of flowers, but my sense of smell has disappeared and I can't enjoy the perfume. Take a deep breath. Take a deep breathing.